Good afternoon from WMDP, your number one source for scientific information in Fargo, the cultural mecca of the Midwest. And as always, I'm Stanley Miller, bringing you the facts. We continue our Healthy Child campaign this week with a look at deadly diseases for young individuals, newborns, specifically focusing on their parents. Learn what to look for, how to get your child tested, and all the important details of this vicious disease. Joining us today, I'm very proud to say, is the critically acclaimed neurosurgeon, Dr. William Beckingham III. Ladies and gentlemen, Mr. Beckingham. He's not. Ladies and gentlemen, I just received some rather unfortunate news. Mr. Beckingham can't be with us today due to a unicycle accident. So instead, we've got one of his pupils present, so allow me to introduce the very astute Ms. Mellowbottom. Hello, Ms. Mellowbottom.
Hello, Mr. Miller. It's a real pleasure.
Well, it's great to have you on. Can I offer you anything? I got water, coffee, maybe a Bloody Mary.
It's 10 in the morning.
Okay, suit yourself. So, Ms. Mellowbottom, what exactly is this Gaucher disease?
It's pronounced Gaucher disease, actually.
I was told. Okay, tell us about this Gaucher disease.
Well, Gaucher disease is present in about 1 in 20,000 live births in the U.S. today. Therefore, parents, you may want to listen up so you know what to look for in case your child has this disease. Gaucher disease is a disease which presents with the deficiency of the enzyme glucocerebrosidase.
It's a big word.
Yes, it is actually. This enzyme is responsible for breaking down glucocerebroside, a lipid that accumulates in several organs throughout the human body. In other words, someone with Gaucher disease does not have a molecule that is necessary to break down fats. And this results in accumulation of these fats in certain organs. Too much of this fat stored in our organs causes the organs to enlarge, which is very harmful for our bodies. There are 3 different types of Gaucher disease. Type 1 is the most common. A patient with this type may have an enlarged liver, spleen, be anemic, and possibly have bone disease. This may present in childhood or adulthood. Type 2, on the other hand, affects young babies within the first 3 months of life. It is not very likely that these patients will live past the age 2. Parents, this is what you need to be aware of what a patient with type 2 Gaucher disease has. They may present with an enlarged spleen and liver, as well as brain damage. This disease is hereditary, so I stress you and your children to get tested. Both parents must be carriers for this disease, so there is a 25% chance of a child getting this disease in this case. Therefore, I urge you to get tested to see if you are a carrier. This can be detected through blood or saliva. Lastly, the 3rd type of Gaucher disease has similar signs as well. Type 3 also presents with an enlarged spleen and liver, as well as brain damage or seizures. An enzyme assay test measuring glucocerebrosidase levels and DNA analysis helps determine if Gaucher disease is present, and if it is, which subtype the patient has.
Okay, well, I'm sorry, I don't mean to interrupt you. It's very interesting. We just actually have to do a little product placement. So, Nutter Butters, the nuttiest butter bar there is. When I need a snack on the go, I always grab for Nutter Butter Bites. They are a real treat. Get that from the shop there. What's in this?
Peanut butter?
There's peanut butter in these?
Yeah.
Oh my god. I'm allergic to. There's peanut butter! Nope! Okay, do you want one?
No.
Okay, great.
Are you okay?
Yeah, no, it's fine. Nutter Butter Bites. Welcome back to WMDP, your number one source for scientific information in Fargo. If you're just catching up with us today, we've got Ms. Mellowbottom here talking about a very lethal disease, Gaucher.
Gaucher.
Gaucher disease. Ms. Mellabottom, you were saying.
Yes, Gaucher disease, it is deadly, especially in patients that have type 2, but however, there is treatment available for Gaucher disease. Enzyme replacement therapy has made a significant impact in the treatment. Ongoing research is being done, and hopefully one day we can find a cure. For now, patients living with Gaucher disease can receive IV injections every other week and can manage the disease. Again, I urge you to test to see if you are a carrier, parents. I don't know. Yeah.
Excellent. Well, Ms. Mellabottom, it has been an immense pleasure having you on the show. We've learned plenty about this great disease, and we really appreciate you coming all the way down from... Actually, no, I don't know that I asked you where you're from originally.
I'm from Moorhead, actually.
Moorhead, is that like Wyoming? Is that...
It's in Minnesota, like 5 minutes away.
I've never heard of that. Okay, well, anyway, can't say how great it was having you on the show. Folks, that's all we have for this week. Next week, we continue our Healthy Child campaign with a look at lead consumption, paint chips, death in disguise, or a delightful treat. We'll find out. Thanks again, and thanks for joining us. I'm Stanley Miller, as always, and this is WMDP, your #1 source for scientific information. Good night.
How about that Bloody Mary?
All right, coming right up. Dum dum da da dum bum 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 da 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 da.